Today on Dueling Doctors, we're talking about three very serious life and death issues: heart disease, kidney disease, and melanoma. What causes these problems, and more importantly, how can we treat them effectively? Doctors from the worlds of holistic, natural, and conventional Western medicine square off on the best course of action to treat these ailments once and for all, and it starts right now. It's holistic and natural versus conventional health experts with different opinions and one goal: to help you live a healthier life. Dueling Doctors. Hi everyone, I'm Dr. Frank Spinelli. Each week on Dueling Doctors, experts from the worlds of both conventional and holistic medicine join us to debate and discuss the best ways to treat what ails us. Let's get started by introducing our guests. On the holistic side of the equation is renowned physician Dr. Ronald Hoffman, and here with the more Western approach is internationally recognized cardiologist Dr. Kevin Campbell. Welcome, gentlemen.
Thanks for having us. Great to be here.
Glad you're here. Our first topic is the #1 killer in the United States, heart disease. It is also the leading cause of death among men and women worldwide. Heart disease encompasses a wide array of issues. For this segment, we'll focus on the #1 cause of heart attacks: plaque buildup in your coronary arteries due to cholesterol deposits that prevent the flow of oxygen and blood to your heart. So now you know what causes it. How do you treat it or prevent it? Each of our experts has up to 1 minute to present a treatment plan, and then the other will be given an opportunity to respond. We flipped a coin before the show to see who would go first, and I have to say the cardiologist is up first. So Talk to me about heart disease, #1 killer among men and women. It looks like it's not going away. What are we not doing to prevent heart disease?
You know, I think one of the biggest problems in the U.S. today is obesity and obesity-related illness, which produces the risk factors for heart disease: diabetes, high blood pressure, high cholesterol. All these things play a role. So I have two jobs. One is to treat the heart attack as it's happening in the acute emergency setting, and then prevent them from happening again in the future. And that's a very difficult thing to do because it requires lifestyle modification and medications to make sure.
Talk to me about lifestyle modification first.
So I think one of the most important things I can do for you if you've had a heart attack is convince you to stop smoking. Make sure you change your diet to more of a Mediterranean diet: fishes, legumes, that sort of stuff, and avoiding red meat. And that's a real critical part to this. And then exercise. And making sure that you stay fit. Even if the best you can do is walk down the street, down Fifth Avenue, at least you're walking.
And so really when you say exercise, are we talking about aerobic exercise? I think a lot of people, a lot of friends that I have, they think once they get to a certain age, they still have to weight lift. And I keep thinking, no, it's really about the treadmill. It's really about building up your stamina, really doing aerobic exercise where you're getting your heart rate up. I don't know how you feel about that.
Yeah, I think that's an important point. The CDC, or Centers for Disease Control, recommends about 150 minutes a week of exercise. They do like some resistance, even in older people.
So diet, exercise, maintaining a healthy weight.
Absolutely.
And then what about medication, dare I say?
So if you've had a heart attack, I have the luxury of thousands upon thousands of clinical trials that have studied patients, and the main outcome is living and dying. And so I have the power of data with me.
Okay.
So
Give us
drugs,
share that power.
The drugs that I love to use are a beta blocker. We know that a beta blocker like low pressor or metoprolol will make you live longer if you've had a heart attack.
Okay, and beta blockers target the beta cells to relax.
They reduce the heart rate, they help
lower
the
blood
heart
pressure.
lower blood pressure, and they also help the heart remodel. After you've had a heart attack, the structure of the heart may be different because of scarring and muscle death, and the heart remodels in a more positive way when you have a beta blocker.
Okay, and what else?
An ACE inhibitor like Ramipril or Benazepril or Captopril.
And I know the science could get very tricky, but when you're talking about ACE, you're talking about something that inhibits the enzymes that lead from, like that we were talking about, the kidney producing renin,
Exactly.
which increases your blood pressure. So this blocks that so that you're decreasing your blood pressure.
That's exactly right. But it has this mysterious effect of making people live longer who've had heart attacks. And it seems to be cardioprotective. And so we don't know exactly why, but we know that these two drugs make people live longer. And then a cholesterol-lowering agent.
Like statins, which is what we hear about.
And there's some controversy with statins, but we know in clinical trials that statins make you live longer.
And what about aspirin?
Aspirin is critically important. The debate lately has been, do you need just one baby aspirin? Do you need 3 full-dose aspirin? And I think we're coming around to really just needing the smaller doses of aspirin because we want to inhibit the platelets, the blood cells.
81 milligrams
right,
is really
81.
the dose you're talking about.
Yes, sir.
All right. Well, we heard a lot of drugs there.
Yes, indeed.
What is your take on this?
We're a mutual admiration society on the emphasis on lifestyle. And clearly, someone who's had a heart attack needs protection. I agree about aerobic exercise and strength training. Strength training actually is more important than has been emphasized in the past because it actually builds up the capacity of the heart. It's beneficial. It also improves your cholesterol profile. But when it comes to medication, I think all too many people are put on statin drugs. I would agree that people may need statin drugs after a heart attack, but studies are showing that statin drugs, while lowering cholesterol, may actually make some patients tired. One study recently showed that the benefits of exercise are actually blunted when people are put on statin drugs, and that's worrisome. People have decreased exercise performance, and they can't build up the energy in their heart.
Is that a direct effect of the side effect being muscle aches?
It doesn't even have to occur with muscle aches. I think one of the misconceptions is that, there's a very small percentage of people who have muscle aches with statins. They're the ones who shouldn't be on statins. But a lot of people who take statins have problems. They should be taking a nutrient, which is coenzyme Q10. Coenzyme Q10 is very helpful for the heart. In fact, there was recently a study that said there's this new medication that's available for heart failure. And I'm thinking, what medication? I read the article. It's coenzyme Q10. It's a supplement that's available in health food stores. From a dietary standpoint, is that it is not proven that saturated fats and red meat are the culprit. I think that there's actually evidence that they may not make a difference according to some recent studies. Amazingly, we used to think fat was the enemy. What does appear to be a big problem, refined carbohydrates, excess sugar, which drive insulin levels up, and that may be what drives a lot of heart disease.
So that's interesting. What do you feel about that?
So let me tell you about the red meat story.
No red meat, no saturated fats, and here you have a naturopath saying, maybe eat some red meat.
So I think this is where I'm basing a lot of my red meat on. There's some recent data that looked at carnitine, which is in red meat, and it's a substance that, when it gets to the gut, is metabolized or broken down by bacteria in the gut that creates another compound that gets resorbed into the bloodstream that is actually very atherogenic, and it helps cholesterol lay down as plaques in the coronary arteries. And so I think that there are some thoughts now where we may even start treating heart disease prevention with antibiotics to destroy those gut bacteria that make the substance in the red meat more atherogenic.
Yeah, I'm all over the particular study you're talking about, and unfortunately, the study looks at carnitine as a source of the harmful chemical, which is called TMAO.
Correct, yes.
Which affects the arteries. But if that logic holds true, soy would cause the same problem, fish would cause the same problem, and we know those things actually protect the heart. So the study is a little faulty. It may be, though, that our gut bacteria influence our risk of heart disease. Instead of antibiotics, I would prefer using probiotics to introduce better bacteria into the intestinal tract.
Yeah, that's a great point.
Now, I know there's some experimental therapies. Can you talk to me about chelation?
Yes, chelation therapy, as it's called. It's been done for at least 50 years in the United States. And at first it was thought to be like voodoo or some kind of quack therapy. But finally they did a big study on it. The National Institutes of Health spent $31 million to study chelation therapy. And to our immense surprise, after 10 years, the study results just out in the Journal of the American Medical Association showed an improvement, a modest improvement of 18% in terms of the risk of heart attack, death, or the need for stent or bypass surgery. So this was a very interesting result.
I stand corrected. What is chelation? What does that involve?
Well, chelation therapy involves an intravenous infusion of vitamins. Patients go to a doctor's office and sit for 3 hours or so, a couple times a week.
It's kind of asking a lot.
It's asking a lot, and it's a long.
And the infusion is not only vitamins; it also includes EDTA.
EDTA, which is a chelating agent which draws excess calcium and toxic heavy metals out of the blood vessels.
Including which heavy metals?
Lead, mercury, cadmium. These are some of the things that may drive inflammation in the blood vessels, leading to heart disease.
Still being looked at. I don't know if there's going to be.
What is amazing to me is if this were a drug, there was a resounding success with this therapy, but still the cardiology community has said, well, we're not ready for this. We'll have to wait. More studies need to be done.
Wow. Well, certainly more to come on that front. We have to take a break, but up next, find out the best ways to detect, treat, and prevent kidney disease. Stay tuned. Welcome back to Dueling Doctors, the show where health experts from the worlds of Western and natural medicine debate the best ways to treat ailments and illnesses that affect all of us. I'm joined by holistic Dr. Ronald Hoffman and our Western-trained physician, Dr. Kevin Campbell. Today we're talking about life and death situations that can affect us all or someone we know. Now it's time to take on kidney disease. The kidneys are like a filter in our bodies. They hold on to the good stuff and then they excrete the bad stuff. With chronic kidney disease, waste builds up, and if left untreated, it will ultimately lead to death. Complications of chronic kidney disease include high blood pressure, anemia, osteoporosis, and nerve damage. Each of our doctors has up to 1 minute to present a treatment plan, and then the other will talk about the pros and cons, and then we'll discuss them both. But Dr. Campbell, you were up first last time, so we're going to begin with you, Dr. Hoffman. Talk to me about chronic kidney disease.
Okay, so obviously the big drivers of kidney disease in this country are, number one, high blood pressure, and number two, diabetes. And when you have both together, it's double trouble. And the vast majority of people on dialysis have one or both of those conditions. So it's very important to keep the weight down, to make sure that there's not excess salt. Actually, it's not even so much the salt per se, it's the ratio of your sodium to your potassium. So if you eat a lot of fresh vegetables and fruits, you'll get adequate potassium to balance out the sodium.
It's very important to talk about keeping an ideal body weight, especially if you have high blood pressure,
Yes.
because you're retaining salt and fluids, and that's the one thing you can't do is excrete fluids when you have chronic kidney problems. And also diabetic control, because we know that high sugars run amok with your vessels and your vessels constrict. So I was going to ask you, as far as diet, how much are you concerned about sodium, potassium, in this case, even a Mediterranean diet? Do you agree that patients should be able to eat high protein or low protein? What is your take on that?
I think one of the pitfalls is when people start developing kidney disease, they tell them, avoid protein. Make sure you have no protein because the kidneys are what...
Protein gets excreted as nitrogen.
The problem is then people eat carbohydrates like a house on fire.
And their
they
sugars
get
go
fat
up.
and their blood sugar goes up, their diabetes control goes out of whack, insulin goes up, it causes blood pressure to go up. So we have to moderate. The Mediterranean diet can be a useful tool, but if you're towards end-stage renal disease, your potassium tends to go up. There's a little too much potassium. You have to watch certain fruits and vegetables because potassium can go up.
It can go up,
Also,
and then you'll have problems with arrhythmias.
Right.
You'll have to see.
Right. I want to mention also toxicity in our environment. Big problem. Heavy metals actually damage the kidneys. So we pay attention to that in looking at our patients whether they have excess lead or cadmium. These are known to damage the kidneys. We try to get the lead out or avoid exposure to lead.
So if I came into your office, let's say, and I'm having, elevated, blood urea nitrogen, elevated creatinine, which are measures for kidney function, would you then go immediately right for the heavy metals and look at them as well?
I would check
It's a
them. I would
screening
make
thing
sure that, and that's not commonly done by conventional
No,
doctors.
I would say
should
it
be
is,
done.
and that's why I'm interested.
Another
That's
thing is
really
we rely
intriguing.
too much on painkillers in this country, and it's been shown that the common over-the-counter medications we use, like Advil, non-steroidal anti-inflammatory drugs, can damage the kidneys. I saw
Well known that they damage
Yeah, I
the
saw one the
kidneys,
other
yes.
day. She was on dialysis. How'd you get that way? No high blood pressure, no diabetes. She just took too many painkillers, and she wasn't taking that many. She was taking 6 or 8 Advils a day.
Well, that's one of the problems with Tylenol toxicity is that people damage their
more.
kidneys and their liver,
Yeah.
right? All right. I'm sure you see a lot of kidney failure, especially with patients with high blood pressure. It's such a tightrope and a balancing act. What do you really recommend for patients that are seeing worsening kidney problems?
So the first thing I would have to agree, we want to remove toxins. We want to make sure that you're not taking Advil, that you're not taking things that we call nephrotoxins or kidney toxins. We want to make sure those are removed. We want to make sure that the medicines that we have you on, maybe for your concomitant heart disease or heart failure, are things that won't hurt the kidney as well. I think it's a balancing act in my patients because I have patients with weakened hearts, and the heart pumps blood to the kidneys, and the kidneys may be failing because they're not seeing a high enough pressure from the heart pumping to the blood to the kidneys. So I think it's very, very important to screen out primary kidney dysfunction from secondary, meaning is it something that we're taking or doing that's causing this, or is it secondary to other diseases like diabetes, like hypertension, or that sort of thing?
I was going to say, isn't it true that you do see a lot of concomitant diabetes, high cholesterol, high blood pressure, and this leads to heart disease? I mean,
Absolutely.
This is really, call it the trifecta. I mean, you really want to have a heart attack, this is what you need. I find that what patients really have a hard time with is going in to see their doctor more than routinely to have phosphorus check, potassium check, creatinine. I mean, do you recommend routine blood tests in these cases?
Particularly when you have kidneys that are beginning to fail, it is vitally important to check a chemistry very frequently because you want to track that rate of failure. You want to see if your therapy is working and the patient's responding. And you also, as we discussed a moment ago, want to make sure the potassium level is not at dangerously high levels, because then you're going to have to see me for a heart rhythm problem.
Heart rhythm problem. I also feel like I think the main goal is to keep patients off dialysis
as long
or prolong
as
it as long as possible, because I think once you become a dialysis patient, then you're talking about EDTA, you're hooked up to a machine 3-4 times a week.
It's a miserable existence. It is.
It's very difficult, and I think it's one of those things. What would you recommend as far as how soon do you think about preparing patients for dialysis or preparing them for kidney transplants?
So in the appropriate patient, kidney transplantation should start early when you know this is a disease that's going to progress to end-stage renal disease. You need to get the family involved, make sure you have the right support system, make sure the patient understands you're going to trade one disease, kidney disease, for another disease, which is transplanted organ.
Right.
Secondarily, when you want to prepare people for dialysis, you go in and get a fistula in early, let it mature over the course of 6 months.
Surgery to get dialysis.
And then they need the emotional support. And I think Western doctors such as myself often forget about the emotional support.
It is very emotional.
I would add, there's a lot of denial about this. Some patients, they just don't want to admit that they're going to have to go on dialysis and have to seek a kidney transplant. And it's important to prepare them. They may be headed in that direction.
Yeah, you want to prepare them early instead of later. Well, thank you very much. We're going to take a break, and when we come back, we're talking about a very serious condition, melanoma. Please don't go away. Welcome back to Dueling Doctors, the Life and Death edition. The last debate on today's agenda is the most serious form of skin cancer, melanoma. The main cause of melanoma is too much ultraviolet radiation reaching the skin. Melanin, the pigment that gives the skin its color, protects the skin from damage by sunlight and UV rays. In fair-skinned people, the skin cells make less melanin, so there is less protection against the harmful rays of the sun. Dr. Campbell, you're up first. So let's talk to you and me about some melanoma.
So two things with melanoma, prevention and treatment.
Okay.
Prevention is all about sunscreen. You need to wear sunscreen every day, whether
The FDA changed their guidelines recently, so tell us the new facts about
You really need to
sunscreen.
have both UVA and UVB protection, at least SPF 15. You need to reapply every 2 to 3 hours.
If you're going to be on the sun, right?
And
Exactly.
you need to reapply as soon as you come out of the water.
Because it is not waterproof. There's no such thing as
foolproof waterproof sunscreen.
And anything less than 15 has to say on the label that this is not going to protect you from skin cancer.
That's exactly right. And there's a big debate about some of the new compounds that are available in Europe that our FDA has not approved yet, and they're actually better because they're more broad spectrum. They get A and B, and most of our things here are just B, and that leaves you unprotected. The second thing is really treatment. Treatment, you need to be aggressive with melanoma because melanoma kills people. It is the #1 cause of death in people that are 20 to 29 years old, the millennials, as we refer to them.
And so really, what are you looking for? I mean, everybody has them all. I have one on my face. I call it the Cindy Crawford mole. I know you were thinking that too. So what about this mole should I be worried about?
So if you notice a change in size, shape, color, if it begins to bleed or looks like it's trying to change its architecture or its structure, you need to see a doctor, a dermatologist. And they need to take a piece of it and look at it under the microscope and decide if it's cancer. If it's cancer, it needs to come out with wide margins.
I think really a dermatological skin assessment is you completely naked, standing there, and him looking at you from head to toe, not this just focusing on one mole, because lots of melanomas are missed. All right, so what is your take on melanoma?
I'm all for that, sun protection in people who are at risk of melanoma, but one caveat is that if we all slather sunscreen on our bodies and hide inside and wear UV protective clothing all the time, we'll become vitamin D deficient. And vitamin D is very protective against a wide variety of diseases, including many cancers. So 30,000 people with melanoma, and it's a terrible scourge, but we got many other cancers that are far more common, like breast cancer and colon cancer, which may be associated with vitamin D deficiency. So we have to get our vitamin D.
Right.
Maybe not from the sun if you're at risk, you have light skin. Take vitamin D orally. That's very important. Also, when it comes to melanoma, There are other risk factors. A poor diet, a diet that is high in trans fats or junk fats, increases the risk for melanoma. That is, that has no fruits and vegetables with all those colorful substances that protect the body from cancer. That can increase your risk too. So you take a person like that, put them out in the sun who eats junk food, it increases their risk, it's additive risk. And also point out that there's some natural substances that are cancer preventive. They're in green tea. Polyphenols.
Yes, polyphenols. I was just reading an article about how they're protective actually for genitourinary cancers like prostate cancer,
Yes.
so also just as good for melanoma.
And they do provide, in some ways, a bit of a natural sunscreen. Don't depend on them if you're going out in the sun.
No,
but
you
they
should
do
definitely wear sunscreen.
They do
SPF greater
protect
than
the
15.
skin, and they protect many organs from cancer. So EGCG from green tea, if you don't like green tea, it's available in pills.
So green tea, whether you like to drink it or take it in a pill form, could be very helpful with melanoma. Well, I'm sorry to say we have to wrap things up, and I want to thank you both for joining us today and for all your great information. We'll be right back. Welcome back to Dueling Doctors, the Life and Death Show. Heart disease is the #1 killer in America. That's why it's vital to take measures to prevent yourself from having a heart attack. Be sure to control health issues like high blood pressure, high cholesterol, and diabetes. Eat a diet that's low in salt and saturated fat, and exercise at least 30 minutes a day, 3 days a week. For chronic kidney disease sufferers, the key is managing your blood pressure, reducing your salt intake, and achieving a healthy weight. And finally, prevent melanoma by using a sunscreen with an SPF greater than 15, and remember to reapply every 2 hours when you're out in the sun. If you find a mole or notice a change in an existing mole, have it checked out by your dermatologist ASAP. I'm Dr. Frank Spinelli. Hope to see you soon on Dueling Doctors for more healthy discussions as you explore the best path to your own personal prescription. And as always, be sure to talk to your healthcare provider before making any medical decisions. We'll see you next time.